Glasdegib basically is an oral agent that has been already approved for patients with acute myeloid leukemia who are unfit or older patients. This approval basically was based on a randomized phase 2 trial that showed actually an overall survival improvement when the drug was combined with low-dose cytarabine in comparison to receiving low-dose cytarabine alone. While the drug was approved, I think there was a lot of hesitation in the US to use it because most providers in the US don't prefer to use low-dose RC for older patients with who are unfit for intensive chemo and rather use hypomethylating agents either as monotherapy or more recently after the approval of venetoclax, for example, in combination with venetoclax. So the main goal of this trial that we presented, the BRIGHT trial basically, was to look at the activity of combining Glasdegib, which is a Hedgehog pathway inhibitor, a smoothened inhibitor, in combination with azacitidine. And we did study patients who have acute myeloid leukemia who were older and unfit for intensive chemotherapy, as well as patients who had higher risk myelodysplastic syndrome, around 30 patients of each subset. The original presentation was in the American Society of Hematology meeting in December, showed activity with the combination and a median survival of around close to 9 months. And what we presented basically were additional analysis from the study in the American Society of Clinical Oncology, in which the main focus was to look at the degree of the myelosuppression that occurs with this regimen. And what we have shown is that the combination doesn't seem to add a significant degree of myelosuppression compared to the use of hypomethylating agent alone. Of course, this wasn't a controlled trial. There was no arm in which azacitidine was used alone, but this was in comparison with other data sets in which hypomethylating agents, azacitidine was alone. Our impression is that the myelosuppression and the count recovery seems to occur relatively faster, especially when you think about other combinations that are out there, such as the venetoclax, that are quite myelosuppressive. So I think additional analyses are being done on this data set. There was also another abstract that was presented focusing on the quality of life improvement for patients. So I think we are trying to better define where Glasdegib does fit in the whole context of treating older unfit patients with AML. And now we are getting into a situation actually of embarrassment of riches in some way. After having no drugs for many, many years for older unfit patients, now we are having more and more active agents such as venetoclax, Glasdegib, FLT3 inhibitors, IDH inhibitors, in addition to the hypomethylating agents and a number of other agents that are in advanced stages of production. So the treatment of AML is becoming more complicated, and we are trying to understand the best combinations and the best sequencing of different regimens at this point.